Good morning. My name is Leland Sommer. I'm a nurse practitioner in Regina at Eden Care Communities. My project was focused originally on appropriate diabetes management in long-term care. Working with the team at Wascana Rehab, that location was chosen. And a key learning was the building of the team is key to any project and not to lead with the solution. The driver diagram was never created because the momentum was building. Senior leadership I had met with the management team and the physician team. And at this point, I had recruited a patient family advisor and we had met a couple times. So the project was starting to get exciting. I was looking forward to meeting with the care team to really drive down into what the problems were, rather than lead with my own assumptions from what I thought I knew from what the evidence would say. And really a lot of this was clarified with working with the data analysis team through clinical appropriateness in Regina. So I truly appreciated how much they influenced and helped me realize what the project required. But of course, in March, COVID happened. And with the continuing care priority focus change and the cohorting impact, it was agreed at all levels that the project had to be put on pause. So a change in course occurred. Sitting at the table of the decision-making team for the emergency management leadership team at Eden Care Communities, a common thread seemed to always come out. There was too much information. The information that was out there was very hard to decipher and figure out what was important to our service locations. With this, I worked with the leadership team to really listen and learn what they wanted. And they wanted a quick picture. They wanted a snapshot so they could figure out what was going on in our locations of service and in the province. So the secondary drivers I would identify as all of those areas of information that were coming in. And one on this list I haven't included is the media, and that is a big influencer, whether or not it's accurate. But we had a continuous bouncing ball of data information from across the province, but very little was being filtered down to this is the picture in Regina, this is the picture in Saskatoon or Moose Jaw. So this made making decisions for the safety of the care partners and the safety of our elders very challenging. And as an affiliate, we carry a different risk than, say, an owned and operated long-term care. One big piece through this was early on, I started to realize that there are many different pandemics happening within our own province. And through the creation of this driver diagram, that shone through. And the importance of creating something that created a snapshot to influence decisions was developed and born. This was the dashboard that came from all of the discussions with the team. The first dashboard, which definitely didn't look like this, was sent out by email August 21st. And I firstly want to say I wish we could go back to those numbers compared to where we are right now. With that first presentation of the dashboard, I made a presentation to our Regina area special care home affiliate and allowed them to ask questions, allowed them to give feedback. This snapshot they truly appreciated because it was something that they could see in their email, they could review at their leisure and get a very quick detail of what was occurring and what the trends were. This current of variation is emailed daily to a group that has requested it. The metrics were incorporated for the cities, which then gives a very quick view of the prevalence. This was not being done, and it's still not really being done at the provincial level. The color coding provides a quick idea of what the risk is. With the current, sorry, lost my mouse. QI is adaptable throughout the clinic and healthcare environment. Truly, I've learned to listen to what is needed, wanted, and attainable, and I'm completely impressed by the system of QI thinkers we've built. And I've learned that assumptions are the downfall to any great idea. So never lead with an assumption or a solution. Listen to what is wanted.